Whitmer, President and CEO for Spectrum Health. And I'd like to welcome all of you to the West Michigan Vaccine Clinic, which is a partnership between Kent County Health Department, Spectrum Health, Mercy Health, and many others. I am pleased to welcome Governor Whitmer and her daughter Sherry, the state's Chief Medical Executive, Dr. Caldoon, to our clinic today, as well as Superintendent Dr. Roby and several Grand Rapids Public Schools students. The GRPS students are ambassadors for the Protect Michigan Commission, which I am also honored to be appointed to by Governor Whitmer. And this Protect Michigan Commission is charged with helping to ensure every Michigander has the ability to get vaccinated against COVID-19. At Spectrum Health, our mission is to improve health, inspire hope, and save lives. We have all been impacted by this virus in some way, whether it's getting sick and having long-term health impact, seeing someone in the hospital, or having a loved one pass away, or managing our daily habits with safety precautions and some of the restrictions. This vaccine is the best way to combat this virus. It is safe and effective. And so I urge you to get vaccinated. It has and it will save lives. It contributes to the overall health of our community. And there are people who cannot get the vaccine, whether it's for a medical reason, a religious reason, or because they are under the age of 16. By getting this vaccine, you are helping our community be healthy and safe. On behalf of the 31,000 team members at Spectrum Health, I'd like to thank all Michiganders who stepped up and did their part to prevent the spread of this virus. We are very hopeful that the most recent surge will be our last, thanks in part to the number of vaccinations administered and you following safety precautions. Today will be our 200,000th vaccine at this clinic. And combined with other clinics, Spectrum Health has administered over 385,000 vaccine doses. I am incredibly proud of all the healthcare workers and many others who have come together to care for our communities and vaccinate our community. They are saving lives, and so thank you. It is now my honor to introduce the governor of our great state of Michigan, Governor Gretchen Whitmer.
Thank you. Well, I'm really pleased to be here today, and I appreciate Tina and the leadership of everyone here at this facility. I mean, this has been an incredible effort to get people vaccinated and to save lives. The hospital system, the local department of public health. I mean, it's just really been, so many have come together to make this happen, and it's really been so critical in our fight against COVID. I'm glad to be here with my daughter, Sherry, and really glad to spend some time with some of the young ambassadors for our efforts to get people vaccinated, and also to thank our frontline health workers who are exhausted. It has been a long, tough 15 months, and yet they continue to do the hard work, and we're so grateful. Today, Sherry and I are going to be getting our second doses of one of the safe, effective vaccines that are on the market. We're really happy. I've already started to make my plans for what I'm going to do in 2 weeks when I've got the full immunity benefits. Joining us, of course, is the woman I spend almost as much time with as I do my own family, and that's Dr. Caldoon, who has helped lead our efforts to navigate our state through these tough times, and she'll be administering the Pfizer shot number 2 for us today. To date, Michigan has administered 6.7 million doses of the safe, effective COVID-19 vaccines. We're likely going to hit 7 million this weekend, which is really exciting. At this juncture, almost 1 in 2 Michiganders have gotten their first shots, and over 1/3 of our population has had the full benefit of these vaccines. These are great numbers. We're going to keep pushing forward, but we're leading and we're ahead of the national average. And so it's something that we should all be proud of because we're all a part of making that happen. We have surpassed 230 million doses as a nation. We met President Biden's ambitious goal and exceeded it by a great deal. So these are numbers I share with you to give hope. If you haven't already gotten your shot, today's a great day to get your shot. After I get mine here in a few minutes, I am, like I said, making some plans for what reconnection looks like with some people that I haven't seen in over a year, and I'm very excited about that. As we keep ramping up our vaccinations, we can all see the light at the end of this tunnel. It's getting brighter. We're still in the tunnel. We still have to be smart. We have to encourage our loved ones and neighbors and friends and coworkers to get vaccinated and keep wearing our masks. But we are getting closer to that normalcy that we all crave. Earlier today, I announced the Michigan Vac to Normal Challenge. We laid out our path out of the pandemic. Our goal remains equitably vaccinating 70% of the 8 million Michiganders who are 16 and older, which is roughly 5.67 million people in our state. Now, the Vac to Normal Challenge has 4 steps, each of which corresponds to a percentage of our eligible population being vaccinated. So we're going to quickly walk through those steps now. Step 1, 2 weeks after we get to 4.5 million Michiganders, or 55% of 16-year-olds and up, as soon as 2 weeks after they get their first shot, we will lift the requirement for employers to require distance work. So no more remote work where feasible. And I know how eager a lot of people are to get back into the office, and I'm confident we can safely take this step forward. I want to thank the Department of Labor and Economic Opportunity for their work group, business leaders, labor leaders, and health experts who participated in these recommendations. At our current rate, we're likely going to get to that 55% number by the end of next week, meaning we could reach step 1 just 2 weeks later. That's before the end of May. Step 2, 2 weeks after we get to 60% of our population inoculated, that's 4.9 million Michiganders, we will increase capacity at sports stadiums, conference centers, banquet halls, and funeral homes to 25%. We'll also increase capacity limits at gyms to 50% and lift the curfew on bars and restaurants. For this step and the next, MDHHS may delay implementation if we see something unique happening, like a 7-day average of new cases higher than 250 a day per million Michiganders. I share that. We think it's very unlikely that that's going to happen, but if for some reason a variant takes hold or there's something that we need to reevaluate, we're going to have to do that if the circumstances require. But we don't think that's going to happen. Step 3, 2 weeks after we get to 65% of Michiganders having gotten the shot, their first shot, will lift all indoor capacity limits, only requiring social distancing between parties, and will relax the limits on residential social gatherings. And finally, step 4, which is 2 steps after we get to 70%. We remember 70% is our big goal. We'll lift the MDHHS gathering and face masks order, and MDHHS will no longer impose broad mitigation measures unless, as I said moments ago, unanticipated circumstances arise, like the spread of a vaccine-resistant variant. And that's why getting vaccinated as quickly as we can is so important. So this is Team Michigan. We all got to be on the same team here. If we get back to normal, right, through this challenge, we're all going to benefit. And to those families and friends and neighbors who still have questions, we want to answer those questions. We want people to have confidence in these incredible vaccines. These vaccines are safe. They will protect you and your family. Over 140 million Americans have already taken it. It's gone through rigorous testing. And the COVID vaccine, like others before it for polio and smallpox, is trusted by doctors. These are, as Tina said, our best shot of putting this pandemic behind us and returning to normal. And if you want to learn more, I encourage you to speak with your family doctor or reach out. There are a lot of resources to get information. If we work together, we can do this. We have a clear set of goals to accompany every step of this process. And as we drive forward our eventual goal of returning to normal, we will pass checkpoints along the way that will allow us to gradually lift other limits, and we will cross this finish line. While I can't predict precisely when we will get to that 70%, I know that if we all do our part, it is very, very real. And it is very likely we can all enjoy the true Michigan summer I know every one of us craves, right? Hanging out at a bonfire, jumping in the lake, having a 4th of July get-together. So, 2 weeks from today, I will be getting together with a small group of my friends who I haven't gotten together with in a long time. I'm looking forward to that, and I know that the more of us who do just what we're doing today, we'll be able to all make these types of plans. So thank you for a few minutes of your time. With that, I think I'm handing it over to Dr. J. Thank you.
Thank you, Governor. Thank you, Tina. It's really exciting to be here in West Michigan, and I really want to thank our health partners, the staff, and the volunteers who made this vaccination site a success. You know, I always say that the best, the best public health work happens with strong partnerships, when people really come together, like they did for this vaccination site, working with the health department, health system, community-based organizations. That's truly what has happened here, and as Tina said, it has absolutely saved lives. These 3 safe and effective vaccines are really the best tools we have to fight COVID-19 and to end this pandemic as quickly as possible. As the governor mentioned, almost half of all Michiganders over the age of 16 and up have gotten at least 1 dose of one of these vaccines. And while cases remain higher than I would like, most statewide numbers actually appear to be trending in the right direction. So as of this week, Michigan has 493 cases per million people. That's lower, that is 30% lower than it was about 2 weeks ago, but it's still 4 times where we were in the middle of February. The percent of tests that are positive is about 13%. That's nearly 3 times where we were in mid-February, but it's 4% lower than we were 2 weeks ago. 19% of hospital beds are still being used to take care of patients who have COVID-19, but the total number of people who are in the hospital for COVID-19 is trending down. So we seem to be starting to come down from this recent surge, but our work is not done. And we know that these more easily transmitted variants are very present all across the state. We also know that our hospitals are still taking care of far too many patients with COVID-19. I work in the ER, and we're still seeing patients younger than they were in the spring and in the fall getting COVID, and some of them are still getting very sick. But these vaccines mean that there is hope. And as the governor mentioned, I expect us to surpass 7 million doses in the upcoming days. Vaccines are also the path for us to be able to do more of the things that we want to do. Earlier this week, the CDC actually released guidance giving people who are fully vaccinated the ability to do more things, like some gatherings without masks, not needing to routinely test and quarantine if you've been exposed, if you don't have any symptoms. And earlier today, as the governor mentioned, we announced a path forward for Michigan to re-engage even more in the things that we all love and want to do. But it all depends on what we do together to get vaccinated. So if you have not already, please do schedule your vaccine appointment. There are many sites across the community, private doctors' offices. We've got mobile sites. We're working with community-based organizations as well. We even have people who are going to people's homes if they need a vaccine in their home. It's also really important that you get your second dose. If you get the Pfizer or the Moderna vaccine, that second dose is really important so that you get the full protection from the vaccine. So I'm honored today to be able to give the governor her second dose, but we are not out of this pandemic yet, but we're getting closer and closer with every person who is vaccinated. So with that, I will ask the governor and her daughter Sherry to come on up. All right.
Good afternoon. The governor has a previous commitment that she needs to get to. I am Dr. Ledrian Roby, Superintendent of Grand Rapids Public Schools. And as we have heard from Governor Whitmer and Dr. Caldoon, young people continue to be increasingly a part of Michigan's population that are getting infected with the coronavirus. And young people of color are among the hardest hit. That's why we are encouraging young people as well as adults in underserved communities to seriously consider scheduling appointments to receive their vaccinations. In West Michigan region, consisting of Allegan, Kalamazoo, Kent, and Ottawa counties, approximately 21,000 teens between the ages of 16 and 19 years of age have already been vaccinated in the 4 counties. That's about 28% of all 16 to 19-year-olds in a 4-county region. This is a great start, given that it's just a few short weeks since the Pfizer vaccination was approved for students in ages 16 years or older. But let's keep it real. You know that young people, unfortunately, do not always listen to advice from their parents, their grandparents, teachers, politicians, or a matter of fact, their superintendent. They listen to their peers, their classmates, and their friends, the people who they hang out with every day. So Project Michigan Commission has introduced the State of Michigan's COVID-19 Student Ambassador Volunteer Recruitment Campaign. One of the reasons that we are recruiting young people to serve as COVID-19 student ambassadors is because of the recent surge and trends that we have seen recently in Michigan. This is good news as cases have started to flatten and decrease in the 4 counties of Kalamazoo, Allegan, Kent, and Ottawa. We are doing so well, but we want to do better. The effort by the Protect Michigan Commission has launched at the Ford Field with Governor Whitmer. She got vaccinated with her daughter and 8 Metro Detroit's finest, brightest leaders on April 6th. Now, Project Michigan Commission is recruiting student champions across the state who will help promote awareness among their classmates on the importance of getting vaccinated. 6 of these amazing teenagers are from Grand Rapids Public Schools and are here with us today. I'm going to ask our young people to come and get their vaccinations now. Their Pfizer shots in arms will be administered today by Sarah Vanderplug, registered nurse, nurse manager from Spectrum Health, Hannah Seeger, registered nurse from Mercy Health, Mary Wazinski, registered nurse, immunization program supervisor from Kent County Health Department. At the same time they will return to their seats, I will introduce them as they wait for 15 minutes to ensure that they do not experience any complications. Now, it is my privilege to introduce Mia Jaden Johnson. Mia is an 11th grader at Grand Rapids University Prep Academy. Mia is 17 years old and a junior. She is the daughter of Stephanie Mitchell and Jamar Johnson and the niece of Jesselyn Johnson. Since enrolling at UPrep in 2019, Mia has maintained a GPA of 4.0 while taking advanced placement courses and classes at Grand Rapids Community College. She cheers at Ottawa Hills High School and was honored to be the captain this year. She is a representative of the District Student Advisory Council. Mia enjoys giving back to the community and has worked about 35 hours of community service before and throughout this pandemic. She is interested in pursuing degrees in psychology and education from the University of Michigan. She works hard to be a positive role model for her younger sisters, cousins, and peers. Mia, on behalf of the state of Michigan, thank you for your service. Attending with Mia today is her UPrep principal, Kenyatta Hill Hall, and her guardian aunt, Jesselyn Johnson. Our next student ambassador is Randell Jones. Randell is a 12th grader at Ottawa Hills High School. He's 18 years old. He is an honor roll student at Ottawa Hills. He's a student athlete who has lettered in 3 varsity sports. He's a senior captain and the record-setting varsity swim team and president of the game club. Randell enjoys exploring historical landmarks, engaging in politics. He is planning on attending Wayne State University and majoring in business. He also applied to and was accepted at Trine University, Wabash College, and GRCC. He has volunteered more than 2,500 community service hours during his 4 years at Ottawa. He is part of the Mayor's Youth Council. Mr. Jones is also a member of the District Student Advisory Council and the GRPS Equity Group, Omega Lads, and Young Men Moving Mountains. He also participated in Seek and Safety and a group called Grownish, which is a young men's group at Ottawa Hills High School. He works in customer service at Ken Fruits Market, and attending with Randall today, is our own Ottawa Hills varsity coach, Christian Verley. Randall, on behalf of the state of Michigan, thank you for your service. Ruby Taylor. Ruby is an 11th grader at C.A. Frost Environmental Science Middle High School. Ruby is 17 years old. She was the 2019 Smart Art Second Prize winner. She is a student member of the C.A. Frost Middle High School Art Club. She is also a student member of the Gender Sexuality Alliance Club. She has been on the school honor roll for the last 3 years, earning a 4.0 GPA each year of high school. She is ranked 4th in the graduating class of 2022. Ruby plans on attending and pursuing a degree in women and gender studies or in the medical field. Attending with Ruby is Principal Brad Lundvik and her mom, Annie Beals. Rudy, on behalf of the state of Michigan, we thank you for your service. Naomi Solis is an 11th grader from Innovation Central High School. She is a 17-year-old junior at Innovation High School. Naomi is part of the Academic and Design and Construction program. She enjoys all types of music and coming to school. Naomi plans to attend college after high school and major in music production. Attending with her today is Central Principal Mark Frost and her mother, Margarita Ortiz. Thank you, Naomi, for your service. Esther Solis, 11th grader, also at Innovation Central High School. She is also 17 years old, part of the she's a junior at Innovation Central. She is part of the Academy of Science, Technology, Engineering, and Math. Esther enjoys digital art and drawing animations. Esther plans to go to college and major in graphic design. Attending with her is, again, Principal Mark Frost and her mother, Margarita Ortiz. Esther, on behalf of the state of Michigan, we thank you for your service. Our next student is Pablo Villavaso, a 12th grader at Union High School. Pablo is the son of Portafiero Villavaso and Pilar Guerrero. He plans to attend either GVSU or GRCC this fall. He wants to enlist in the National Guard and study communications. He currently sits on the FEMA Region 5 Youth Preparedness Council. He is president of the Mayor's Youth Council, Youth Grant Committee co-chair, and the Grand Rapids Community Foundation Dream Fund student representative. He interned at New City Kids and serves as the Lieutenant Governor of Michigan Youth and Government Conference. He has volunteered at Gilda's Club of Grand Rapids and interned for Bill Saxton, the state representative. Attending with him today is Union High School Principal Aaron Rusi. Pablo, on behalf of the state of Michigan, we thank you for your service. Let's give all of these outstanding leaders, student leaders, another round of applause. And we'll hear some closing remarks from Spectrum CEO, Fries Decker.
Thank you, Superintendent Dr. Roby, and thank you to our GRPS students for stepping up as ambassadors for this vaccine. We're so very proud of you. On behalf of our healthcare team members, we cannot thank you enough for taking this virus and the latest surge seriously. I also appreciate our community partners, the Vaccinate West Michigan, Kent County, Mercy Health, and as well as employers, schools, and community leaders for working together to help provide the vaccine to so many people so quickly. I want to acknowledge and thank the Michigan National Guard for all of their hard work and support these past several weeks and months in helping us with this vaccination process. And I also want to welcome the members of the U.S. Department of Defense who started this week in administering vaccines here at the West Michigan Vaccine Clinic. For more information about our vaccine clinics, you can visit vaccinatewestmi.com.